A 72-year-old man sat across from me in my office not long ago. He told me he'd been doing things the same way for 50 years. Same routine, same habits, nothing new. But something felt off. He couldn't quite put his finger on it. He wasn't sick. He wasn't on any new medications. Nothing dramatic had changed in his life. Yet something was wrong, and it had been creeping up on him slowly. After we talked for a while, the answer became clear. The issue wasn't a disease or a deficiency, it was how he was masturbating. And without realizing it, those long-standing habits were quietly affecting his health, his heart, his prostate, and his sensation. This is far more common than you might think. Many older men have no idea that the way they've been doing this for decades could actually be causing real, measurable harm. My name is DR.NERITA. I'm a urologist with over 12 years of experience helping men over 60 reclaim their strength, their circulation, and their confidence. And I want to be very clear about something right from the start. There is no shame in this conversation, no pills being pushed, no confusion or medical jargon designed to make you feel lost. Just honest, straightforward information that could genuinely change how you feel. Here's the thing, masturbation is healthy. Science supports that. But it's healthy when it's done the right way. And after the age of 60, certain habits that may have been perfectly fine when you were younger can start working against you without showing any obvious warning signs. You just gradually feel less, perform less, and recover less, and you assume it's simply aging. Today, I'm going to walk you through 7 specific mistakes that older men commonly make. And more importantly, I'm going to give you the fix for each one. These are mistakes that can quietly drain your energy, reduce your performance, and compromise your health. And I'll tell you right now, mistake number 6 is one that almost every man gets wrong, and the consequences might genuinely surprise you. So stay with me through the entire video. Before we dive in, if you're a man over 60 who values this kind of honest, practical health information, go ahead and subscribe to the channel and turn on that bell notification so you never miss these weekly insights. Drop a comment and tell me where you're watching from. I love seeing the global community of men we're building here, men who are committed to taking care of themselves at every stage of life. All right, let's get into it. The first mistake is one I see constantly, and it's using pornography as the primary source of stimulation. Men in their 60s and 70s come to me and confess that they've noticed a real drop in physical sensation. Touch doesn't feel like it used to. Intimacy with a partner feels distant. Pleasure has become mechanical, like going through the motions without really feeling much. And almost every one of them assumes the same thing. They think they're broken. They think age has simply taken this away from them. But that's not what's happening. They're not broken. They're overstimulated. Here's what I mean. After the age of 60, your brain's dopamine system becomes less flexible. It doesn't bounce back as quickly as it once did. When you regularly expose it to the kind of high-intensity visual stimulation that pornography provides, you're flooding that system with more dopamine than it can comfortably handle. Over time, it adapts by becoming less responsive. That's called dopamine fatigue. And the result is that normal, healthy touch starts to feel dull. Real intimacy feels muted. Pleasure becomes harder and harder to access, and you need more extreme stimulation just to feel something. This isn't aging. This is a brain that's been pushed too far in one direction and needs a chance to recalibrate. The fix is straightforward. Take a 14-day break from all visual stimulation. No screens, no videos, no images. Instead, relearn how to experience arousal through touch, through breath, through presence. Let your body's natural response system come back online. You'll be amazed at how much sensation returns when you give your brain the space to recover. The second mistake is one that seems completely harmless, and that's exactly why it catches so many men off guard. It's masturbating while sitting on the toilet. I understand the logic. It's private, it's convenient, you're already in the bathroom. But that hunched over seated position does something you can't see or feel in the moment. It restricts blood flow through your entire pelvic region. After 60, healthy circulation is absolutely critical for your prostate, for your ability to achieve and maintain erections, and for proper bladder function. When you're sitting hunched over on a toilet, you're compressing exactly the areas that need open, unrestricted blood flow. Do this regularly over time, and you may start noticing groin aches, weaker urinary flow, post-urination dribbling, and a general sense of tension and discomfort in the pelvic area. The fix is simple. Change your position, stand up, recline on your bed, lie down. Choose any position that gives your body space and allows natural movement. Your pelvis needs room to breathe, and the difference this small change makes in circulation and comfort is genuinely significant. Mistake number 3 is rushing through the experience, treating it like a task on your to-do list that needs to be completed as quickly as possible. When you rush, your heart rate spikes suddenly, your blood vessels constrict, and your body shifts into a stress response rather than a pleasure response. You skip right past the oxytocin release, which is one of the most beneficial hormonal effects of healthy sexual activity. Oxytocin is the hormone that creates feelings of calm, connection, and well-being. When you rush habitually, the experience feels draining instead of replenishing. It feels empty instead of satisfying. And over time, you're actually rewiring your brain to associate this act with shallow, unsatisfying pleasure. The consequences build up. You lose sensitivity, you lose stamina. Eventually, you start losing interest entirely. And once again, you blame age for something that's actually about habit. The fix is to slow down and be intentional. Your body after 60 thrives on calm, not tension. There is no finish line here. There's no clock to beat. Approach it as a connection with your own body rather than a race to the end. Let the experience build naturally. Breathe. Take your time. The difference in how you feel afterward, both physically and mentally, will tell you everything you need to know about why this matters. Now, mistake number 4 is one that most men don't even think about, and it involves the pelvic floor. Your pelvic floor is a group of muscles that sit beneath your bladder, your prostate, and your sexual organs. These muscles are responsible for supporting erections, controlling your bladder, and contributing to the intensity of sensation and climax. They are absolutely crucial to your sexual health and function. The problem is that these muscles weaken over time from age, from prolonged sitting, and from chronic stress. And when you masturbate without ever consciously engaging them, you're doing nothing to maintain their strength. In fact, you may actually be contributing to their decline. I had a patient, a 68-year-old man, former firefighter, physically fit by any standard. Strong upper body, active lifestyle, no major health issues, but he came to me because his sexual function was fading. Erections weren't what they used to be. Sensation was diminishing. He was experiencing post-urination dribbling. He assumed it was just his age catching up with him. When we assessed his pelvic floor, the answer was immediately clear. Those muscles had weakened significantly, and everything he was experiencing traced right back to that. The symptoms of a weak pelvic floor include dribbling after urination, weaker and less reliable erections, and reduced sensation during sexual activity. Here is the fix, and it's one you can start practicing immediately. During moments of arousal, consciously contract the same muscles you would use if you were trying to stop your urine flow midstream. Hold that contraction for a few seconds, then release. Repeat this several times. This simple exercise builds tone in those muscles, improves circulation throughout the region, and over time, you'll notice real improvements in strength, sensation, and control. Mistake number 5 is getting the frequency wrong, and this one goes in both directions. Some men overdo it, and some men barely do it at all. Both extremes cause problems. Too much frequency irritates the prostate, dips your energy levels, and slows your body's recovery between sessions. You end up feeling drained, sluggish, and sometimes even sore. On the other hand, too little frequency creates its own set of issues. Blood flow to the region stagnates, nerve responsiveness declines. And over time, a kind of atrophy sets in where the tissues and muscles simply aren't being used enough to maintain their function. Your body needs rhythm. It needs consistency without excess. For most men over 60, the ideal range is about 1 to 2 times per week, approached with awareness and intention rather than compulsion or habit. But I want to emphasize that this is a general guideline. Your body will give you signals. If you feel drained and depleted afterward, you may be doing it too often. If you feel stagnant and disconnected, you may not be doing it enough. Listen to what your body is telling you and adjust accordingly. Now we've arrived at mistake number 6, the one I told you almost every man gets wrong. This is using too much pressure and force. Here's why it happens. As men age, sensitivity naturally decreases somewhat. Touch doesn't register as intensely as it once did, so the instinctive response is to grip harder, squeeze tighter, use more friction and more force to try to recreate the level of sensation you remember. It seems logical, but it backfires badly. Excessive pressure and force cause micro tears in the delicate tissue. Over time, those micro tears heal as scar tissue, which is less flexible and less sensitive than the tissue it replaces. You lose elasticity. And in some cases, this repeated trauma contributes to the development of curvature, a condition known as Peyronie's disease, which can cause pain, difficulty with intimacy, and significant emotional distress. I've seen this in my practice more times than I can count. Men who come in having lost significant sensation, and when we trace it back, the cause is friction trauma from years of using too much force. What's worse, this pattern rewires your brain to associate pleasure with struggle and force, which takes you further and further from the natural, relaxed sensitivity your body is actually designed for. The fix is to consciously choose gentle touch. Prioritize blood flow and comfort over force and friction. Less pressure, not more. Let sensation build through patience and relaxation, rather than trying to force it through intensity. Your body will respond. It just needs you to stop fighting it and start working with it. The seventh and final mistake is one that might sound surprising, but I believe it's one of the most important. It's masturbating without any emotion, connection, or intention. For many older men, this act has become purely mechanical over the years. It's a joyless habit, sometimes driven by boredom, sometimes by loneliness, done on autopilot without any real feeling or presence behind it. When it becomes that mechanical, you lose the hormonal benefits that make it healthy in the first place. The oxytocin release diminishes, the dopamine response flattens, and what you're left with is an empty feeling after climax, a sense of, why did I even bother, that lingers and leaves you feeling worse than before you started. Men feel this and once again assume it's age stealing something from them. But it's not age, it's disconnection. Here is something I genuinely want you to hear. Solo touch can be a powerful act of reconnection with your own body. It can be a moment where you breathe deeply, where you feel gratitude for the body that has carried you through decades of life, where you reconnect with your own vitality and aliveness. When approached this way, with emotion, with breath, with intention, it becomes something that actually heals and replenishes rather than depleting. Let me bring all of this together with a clear set of steps you can start applying today. First, cut the visual overstimulation. Step away from pornography and rediscover arousal through your own sensation and imagination. Second, change your environment and your position. Choose a relaxed posture that supports healthy circulation. Third, slow your rhythm and treat this as a form of relaxation, not a race. Fourth, engage your pelvic floor with gentle contractions during arousal to build tone and improve blood flow. Fifth, find your natural frequency, which for most men over 60 falls around 1 to 2 times per week, approached mindfully. Sixth, use gentle touch and prioritize flow and comfort over pressure and force. And seventh, bring emotion into the experience. Add gratitude, breath, presence, and genuine connection with your own body. I want to speak directly to you for a moment. You are not broken. You are not past your prime. Your body is evolving, and it needs a different kind of attention now than it did 30 or 40 years ago. Aging doesn't mean your relationship with your body has to become distant or disappointing. It means you slow down, you get curious, you listen more carefully. And when you do that, you often discover that there's more feeling, more vitality, and more capacity for pleasure than you ever expected. If this video helped you, hit that like button and share it with a man in your life who might need to hear this. There are millions of men dealing with these exact issues in silence, and sometimes one conversation, one piece of honest information is all it takes to change everything. Subscribe to the channel for weekly insights designed specifically for men over 60 who refuse to accept that their best years are behind them. Because they're not behind you. Your best years are ahead, and they start with how you choose to take care of yourself today.